Hello, my name is Maticia Johnson, and today I would like to give my presentation on advocating for public health issue of diagnosed HIV individuals. Slide 2 will give an introduction of my presentation about how HIV is steadily rising and affecting so many people around the world. After after viewing this presentation, you should be able to understand the scope of why the environment settings of this vulnerable group of people are in need of some type of policy that can create awareness and programs that can aid in lowering the increased numbers of diagnosed HIV individuals, considering the factors that contribute to the health and well-being, which deals with the social status, the social capital, and human capital. It is a certain data deficiencies in these factors is likely the cause of higher levels of mental dullness in stressful situation experience by members of low socio-economic groups. My presentation will be based on the perspective of HIV individuals and how creating a policy will lower the increasing numbers that are statistically recorded daily. The next slide is an overview and a description of HIV. The next slide is a diagram giving details of the life cycle of HIV. The next slide is giving information about the public health issue. The identification of people that are at risk can be interpreted based on patient information and how well statistical data within a vulnerable populated area. The ability to address the needs of those at risk will lead to faster patient recovery and lowering the cost of patient care that is needed to treat the diagnosed HIV individuals. This disease does not have a face on it and is steadily claiming the lives of so many human beings around the world. The spread of the virus is contracted through bodily fluids such as semen, pre-seminal fluid, breast milk, and blood of an infected person. But the main contact is through anal or vaginal sex and the sharing of needles through people using drugs. There are so many people that are not educated and knowledgeable of the virus and its condition. Therefore, many naive people are contracting disease due to promiscuous sexual activities and displaying other risky and reckless behavior. The next slide is the CDC statistical data, and it gives information of will provide estimation on the rise of diagnosed HIV among youth ranging for ages 13 to 24 years of age. The next slide is the chart showing the numbers and how they have increased, how the numbers were 3 years ago. The next slide is information about the proposed public health policy. The purpose of devising a proposed health policy is to aim towards the awareness of lowering the number of diagnosed HIV individuals among all communities around the world. This next slide is the proposed public health policy continuation, which will give an overview that will make sure that the diagnosed HIV individuals are able to seek treatment, help, and assistance from the government despite their health and medical conditions. As the focus goal of this policy will be based on the determination of making a difference that will achieve measurable goals that will be beneficial to everyone, in addition to fulfilling the mission of creating a stronger organization that offers quality resources that will allow the individuals to access medical treatment that is optimal and affordable. This will allow the intersection of the economic factors to become different for the person, because the recovery and integration can help the persons to overcome the barriers that led them to being among the vulnerable population or contracting HIV. The next slide is a continuation of the proposed policy with other information. This slide is a diagram of feelings which will give an overview of how HIV individuals and their family members will deal with the illness as the proposed policy will. As the implementation of the proposed policy will aid in trying to eliminate the individuals from feeling like their world is over due to the health condition of the individual. This next slide is the biopsychosocial model of health paradigm, which combines the physical health with social and psychological aspects of a human's interface of society. This model clearly details the model health of an individual that has been diagnosed with HIV. The next slide is another diagram that gives an overview of how an individual with HIV and their health condition is viewed within the environment. The person and environment perspective, which coincides with psychosocial paradigm through both the psycho and social aspect. This means that the desires and needs of a person has come from the psychological part of the brain. Also, desires come from the social points of the paradigm. So the paradigm would just give you basically information like the resources, which is the environment, the goals, how the person want to achieve them, the culture, the rights, the ability, the inner resources, etc. The next diagram is an illustration on the ecological system theory, which coincides with both biosocial paradigm and the person and environment perspective through the micro, eco, meso, and just basically the group of macro systems and the attitudes and the ideologies of the culture. The next slide is the proposed policy effects. This is an overview of how the proposed policy will have an effect on the world. The information provided will show how the policy can aid in reducing increased numbers of newly individuals will be diagnosed with HIV by providing various solutions and resources for the individuals and their partners. Their partners, and family members. The next slide is the continuation of the proposed health policy effects. And further continuation of it with information. And then the influential affecting behavior of legislators. This is detailed information pertaining to why the legislators should get on the bandwagon of voting for this newly proposed plan that would save the lives of people, especially those that are affected in the vulnerable communities around the world. The ability to provide resources that will be within the budget allocations, operational planning that were derived from the use of well-managed strategic planning. And these are my references. References used for the presentation and the end of my presentation of public advocacy of the public advocating for public health issue or diagnosed HIV individuals. I hope that this is valuable information that will be helpful and used towards making a difference in society for now, starting now and the future to come. Thank you.